So good afternoon, everyone. Thank you for joining us for this presentation, and I want to thank the Canadian Centre for Activity and Aging to welcome me for this webinar. So the goal this afternoon is to present to you on the Prediabetes Initiative and Partnership programs and research. And the Prediabetes Initiative and Partnership is a win-win partnership, we believe, supporting our community, making diabetes prevention a priority since 2007. Here's an overview of the presentation. So first, we'll talk about the growing burden of type 2 diabetes, the evolution of the Prediabetes Initiative and Partnership, and then I will talk to you about 3 research projects that we've been working at. The first one is to increase awareness of risk factors for the development of type 2 diabetes. The second one, which we just finished, is about the vegetable and fruit intake of individuals with prediabetes. What about their barriers, facilitators for intake, and intake patterns? And finally, a third project we're about to start in May called Prepare for a Healthy Lifestyle, which is a patient-centered education program for middle and older adults. So let's get started.
You did? What?
So we know that type 2 diabetes has been a growing burden for our communities, and its prevalence is increasing in our country and worldwide. And it's associated with an increased incidence of obesity, excessive energy intake, and often reduced physical activity. We know that type 2 diabetes and its complications are contributing to increase the cost of the healthcare system and unfortunately reduce the quality of life of people with the type 2 diabetes. So it makes sense then to develop programs to help people prevent or delay the development of type 2 diabetes. And it's been found that we can help by increasing the intake of healthy foods such as vegetable and fruit in the diet to help decreasing the risk for individuals to develop type 2 diabetes. We believe that focusing on prevention rather than just treatment once the disease has developed helps to reduce the pressure on healthcare providers and the resources available for clients in the community. Lifestyle modification interventions targeting physical activity, healthy eating, and weight management have been shown to increase impaired insulin secretion and action in clients who have prediabetes, and that it helps to reduce the risk of developing type 2 diabetes by about 58%. These are recognized strategies to help delay or prevent the development of type 2 diabetes and modify cardiovascular risk factors. And it's been shown that they are cost-effective in individuals not only with diabetes, but also with prediabetes. Let's talk about the Prediabetes Initiative and Partnership. In 2005, the Diabetes Education Center of St. Joseph Healthcare was starting to provide a single education session to about 16 clients per month with prediabetes. And they offered that presentation from 2005 to 2007. And they were acknowledging that it would be good to have more resources to help more people being diagnosed with prediabetes in our community of London, Ontario. So in 2007, an opportunity came about of a collaboration between the Diabetes Education Center of St. Joseph Healthcare, London, as well as Gresham University College, to develop this new and innovative prediabetes education program and partnership. A partnership that to us is making a lot of sense. And to do this, we had the generous support from Sanofi Aventis. The Diabetes Education Center of St. Joseph Healthcare has a wealth of expertise in diabetes education and they certainly have many health professionals and certified diabetes educators to help clients. They're also a referral source. That means that physicians in the area of London refer their clients they diagnose with prediabetes and diabetes to the Diabetes Education Center. Brescia University College has facilities that have the technology to welcome large amounts of people and assist them for education about prevention of diabetes. We have a whole team of students who have a wealth of energy, enthusiasm, and are building knowledge to help people preventing type 2 diabetes. And of course, the students really benefit from the experiential learning of interacting with clients with prediabetes and learning and assisting the certified diabetes educators. At the same time, in 2007, the Division of Food and Nutritional Sciences was starting a new master's program in food and nutrition, and we saw that it was an opportunity through this partnership to do more research to help to evaluate the outcomes of the education programs that we were developing through the partnership, and involving some of the grad students. So here you see a photo of some of the students involved as part of the team. And so far, we've had 5 graduate students, part of the master's program in food and nutrition at Brescia, being involved with this project, as well as quite a lot of students from the undergraduate program of food and nutrition, but also from various fields. We started with a team of about 25 carefully selected and trained undergraduate students and 1 graduate student, and we've developed that team to currently have 65 undergraduate students and currently 3 grad students working on helping out to develop and offer our programs. Interdisciplinary students include people from medicine, nursing, social work, psychology, physical activity, health sciences, and others. The student team is involved in different ways and is an important part of our program. Some of our students are coordinators. That means they help to organize the other students and how they're being involved. Currently, we have 2 senior coordinators. 1 just had a baby. We have 2 junior coordinators. And usually they've been involved with the program and they understand the different roles that the students have to play, and they're good at mentoring the new junior students. We select students to become speakers and we train them, and they do some auditions, and then they're able to present part of the programming to the clients. And we always have a certified diabetes educator with us to help answering the client's questions. But it's empowered our students quite a lot. And the students help the participants when they come to the sessions in different ways. You can see in that photo, on that photo, we have students that are welcoming those clients coming for prediabetes education. And the feedback we've had from participants is they quite like interacting with these future healthcare professionals. We also break up in small groups during the presentations and do activities, and the students are trained to assist with those. We have students participating in special projects, such as developing some healthy recipes and food demonstrations, a healthy eating calendar, interactive displays. And of course, the students are taking part in assisting with research. So the prediabetes research at Brescia University College stemmed from the recognition that there had been a little research about how to increase awareness about type 2 diabetes and its risk factors. As well as you know, most programs are offered through hospitals, and we wanted to assess the effectiveness of a community-based group education program to help delay or prevent type 2 diabetes. So the program is not offered at the hospital, it's offered at the university in partnership with the hospital. And then we wanted to assess the barriers and facilitators to fruit and vegetable intake in individuals who have prediabetes, because we have great interest in nutrition and fruit and vegetable intake that is healthy, following recommendations, seem to be helping to delay or prevent the development of diabetes in those with prediabetes. So here are our partners, the Diabetes Education Center of St. Joseph Healthcare, and Dr. Irene Ramyak is the medical director. Janine Matheson and Pam Colby are two amazing educators, certified diabetes educators and dietitians, very involved with client education as well as mentoring our student team. Michael Oates is one of the managers at the Diabetes Education Center. So at first we started, I was the only faculty member, but we've now grown this program and have 3 researchers with us. Our research coordinator, Jillian Mendich. Pam, you can see, has 2 different roles, and she really helps us to connect very well with the Diabetes Education Center. Here are our 3 grad students currently involved with the program, our team of undergrad students and coordinators. We currently have 8 work study students. And we are thrilled about partnering with the Canadian Diabetes Association and Trevor McClellan, as well as the Canadian Centre for Activity and Aging at Western with Clara Fitzgerald and Shannon Belfry. For this partnership, we have been able to have the great support of the Lawson Foundation, which we're very thankful for as well. Our current program, which we've offered between 2007 to present, include a 2-part education session offered monthly. Why did we end up creating a second presentation? It was based on feedback of participants who told us that they wanted more education. And approximately, we currently have 30 individuals with prediabetes coming at each session, which is offered monthly. Over 1,000 individuals with prediabetes came to our presentation so far, and each client is more than welcome to bring a significant other, a friend or family member to assist them, because we believe that will increase their support system once they're back home and in their community. Our successes are based on different components, including innovation. This is a unique and new strategy for providing disease prevention education in the community and helping to reduce the strain, if I may say it that way, or the demands on the healthcare system, on the hospital. And we focus on who we serve using large classroom facilities to help to reduce wait time that at the beginning was quite a few months that they had to wait to have access to care. Large team of student volunteers are helping us to have some individual attention and interaction with the participants. And sometimes at the hospital, parking costs can be a barrier, so we currently do not have any of that fee at the university. We foster collaborative relationships to try to put all of our resources together and better help more individuals. And experience and training for future healthcare professionals and researchers is what we promote. It is, of course, a research opportunity for students through also our master's program at the university to work with this population of clients. But with the grad students, we also get a lot of great help. And we help providing to the Diabetes Education Center some valuable outcome measures that are essential for planning programs and then improve constantly programs through feedback and research to better serve the population. So I'm now going to give you an overview of the 3 research projects. The first one, the effect of a healthy lifestyle group education session on the awareness of risk factors for type 2 diabetes in adults diagnosed with prediabetes. Amy McDonald who is now a registered dietitian working in the community, was our grad student, and she was really empowered about developing our presentations and assisting our clients. Here's what we saw when looking at a sample of 108 clients with prediabetes at the beginning of that project. The average age was about 59 years of age. About half were elderly and half middle adults. About half were men, half women. The average body mass index was obese. All of the individuals were overweight or obese. Only a small group were from high-risk ethnicities, increasing their risk of diabetes. So that means that most of the clients we were attracting were Caucasian individuals. The time since their diagnosis with prediabetes was about 3.5 months. And you can see the large standard deviation here because there was a wait time at the beginning to have access to education. But as we started to offer the program regularly every month, then the wait time was much reduced. So right now we are meeting the needs of the community. Almost all the individuals had a family physician and had been referred by their family physician to, of course, the Diabetes Education Center. And only a small proportion of them were aware that they had high blood glucose before being diagnosed with prediabetes. So we thought possibly they were not aware of some of the signs and symptoms for prediabetes. We saw that many of them were taking medication to manage their prediabetes as well as comorbidities. So 80% were taking medications, and on average, they were taking 4 prescribed medications. And when asking them a little bit more in detail, we saw that about 60% were having high blood pressure, many of them taking medication to help manage blood pressure. Half of them had high blood cholesterol concentration, 3/4 of them taking medication to manage that, and then some of them had high blood triglycerides and were also taking medication to manage that. So we know that these clients had some comorbidities and some other risk factors for the development of diabetes and cardiovascular disease. Asking those clients about their lifestyle, we were able to see that on average, they had exercise for nearly or just under an hour the day before. Now you can see that this is including walking, and then there's quite a large standard deviation. When looking a little bit more closely at the data, we saw that quite a few of those individuals were sedentary. When asking them about their consumption of vegetable and fruit the day before, we saw that the average intake was under 4 servings per day, which is below Canada's Food Guide recommendation of 7 to 8 daily servings of vegetable and fruit. So this is a summary of some of these early results from the first project. It seems that people with prediabetes in London and area who were coming through our education program were middle and older adults, about half and half, that almost all of them were overweight, obese. We were able to assist about half women, half men coming to our presentation, so both genders were attending, and they were taking multiple medication, on average 4 different medications, and they had a low average of daily intake of vegetable and fruit. In addition, many reported risk factors for developing diabetes, in addition to being overweight and being sedentary or having a low intake of vegetable and fruit, such as family history of diabetes. We saw that a group education session helped to increase clients' awareness of risk factors for type 2 diabetes and which ones they can help to have an impact on. And the education seems to have helped them to know better about the signs and symptoms of diabetes. So if they were to develop diabetes, that would assist them in referring to healthcare professionals. The second research project, which we just finished, was looking more specifically at vegetable and fruit intake. And Victoria Coates is now a registered dietitian working in Ottawa. Tori was actually one of the volunteers, part of the student team, when Amy was the grad student assisting with research project number 1. And as she entered the master's program, she said, I would love to take a look at the vegetable and fruit intake of the people with prediabetes, trying to gain a better understanding about the barriers and facilitators and the patterns of intake of those healthy foods. So it wasn't hard to slide into that research project. And our research objectives were to find out, are individuals with prediabetes meeting vegetable and fruit intake recommendations as listed in Eating Well with Cannabis Food Guide? Again, we hypothesized that the intake was probably below recommendations, but we didn't know much about the variety of intake of those vegetable and fruit and the knowledge of individuals about the number of servings recommended per day. And we wanted to take a look at barriers and facilitators for the intake of those foods, because we thought maybe we can assist those individuals better through education. For this project, we used a food frequency questionnaire, and I'm reporting data for 60 clients today, but I'm hoping that in the future I might be able to give you even larger sample size. We have now collected data for a full year, which is a good thing to do when using a food frequency questionnaire and looking at vegetable and fruit intake, because you know there might be seasonal variations in the intake of some of the vegetable and fruit, and that might also affect some of the barriers and facilitators depending on the time of the year. So we've now collected the data for a complete year. But looking at the preliminary results for 60 clients, what we found is that same thing as for the first research project. The average age was 59 years of age, quite a range of ages, but about half and half were middle and older adults, about half and half males and females. Again, the average body mass index was in the obese range. So keep in mind that these are preliminary results, and we are looking more in detail at some of our results right now. But you can see one side of the slide is about vegetable intake, barriers and facilitators, and the other side about the fruit intake, and what clients told us were top barriers and top facilitators for the intake of those. Let's start with vegetable intake. Looking at the top barriers, people told us the amount of time to prepare can be a barrier for them to consume vegetables. So, immediately we're thinking about including some information to help out with this component in our education. How can we help people preparing a larger amount and then, having some, freezing some, and planning ahead so that we help reduce the time it takes to prepare, and show them some ways that they can do that more effectively. Daily routine or habits, mood, taste, or texture of vegetables might not be as liked by some individuals. So again, opportunities, we see that we can help clients to try different vegetables using different recipes to find ways that they might enjoy eating their vegetables. In terms of facilitators, advice from the health professionals, knowledge on the benefits of eating vegetables came out as top facilitators, which was very nice to see, because that means that they're looking towards us to find out more about vegetables and how we can advise them. So again, through this education, we see a lot of support from the clients who want to find out more and know more. And another facilitator was the quality available. So the more quality of vegetables, possibly that helps with the intake of vegetables. Now, looking at fruit. You see that I've bolded the daily routine or habits, daily habits, or the mood as barriers for both vegetable and fruit. And here I'm not presenting for men separately than women, but we have observed that these seem to be top barriers that we want to help people in their daily routine to make it easier to include the fruit and the vegetable. And for the mood, it seems that quite a few women mentioned that it was a barrier. So that means the way they feel that day or their emotions actually seem to possibly have an impact on their intake of fruit and vegetables. And we're looking to find out and hear more about that from the client. The quality available and the cost were also barriers. For facilitators of fruit intake, again, in bold, you see some of the same components that the clients told us. If I had more knowledge about the benefits of those fruits and advice from health professionals, then I would see that as a facilitator to consume more fruit. So I guess it's empowering health professionals and nutritionists and people who are helping through education to say, look, it seems to be what those clients with prediabetes want to receive to help them consuming the fruit and vegetable. And another facilitator was the variety available. This slide shows you the most frequently selected vegetables and fruit and the least frequently selected vegetables and fruit from those clients with prediabetes from our sample. We saw that the vegetables that are most frequently consumed through the food frequency questionnaire, we've been getting that information. So onions, lettuce, and potatoes. Least frequently consumed, Brussels sprouts, pumpkin or orange-colored squash, sweet potatoes, or yams. So when looking at this, we're thinking, okay, we're not surprised about potatoes. Kind of nice to see the lettuce in there. And it seems that the orange-colored vegetables are less frequently consumed. Looking at the fruits that are more often consumed, apples, bananas, and grapes were the top ones. Least frequently consumed, the clients reported that mangoes and papayas, as well as apricots, and applesauce. So you can see that our food frequency questionnaire was fairly detailed, and even we had different ways that a given vegetable or fruit was indicated in the food frequency questionnaire. So the apple here most frequently consumed was a fresh apple. Least frequently consumed applesauce, a processed apple, basically. Looking in retrospective, it seems that orange-colored vegetables are less frequently consumed by those individuals. And you're going to say, wait a second, where's the carrot in there? That's an orange-colored vegetable, and you're totally right. So the reason I didn't report it here is that it was not the most or the least frequently consumed. It was somewhere in between. Not presented here, we did an average of the number of servings of orange-colored vegetable and different color vegetable consumed per day, because you know Canada's Food Guide is telling us that not only we need to consume vegetable and fruit, but a variety of different vegetable and fruit and variety of different colors, because the orange vegetables and fruit are a good source of beta-carotene and antioxidants, whereas, for example, the dark green vegetables are a very good source of folate. So it seems to us from those preliminary results that we have some good work to do to help clients consuming more frequently the orange-colored vegetables. So some of these results that we saw so far is that most participants underestimated the daily number of vegetable and fruit servings that Canada's Food Guide is recommending. And on average, they've told us that 4 to 5 servings per day is what they thought that they should be consuming, when we know that Canada's Food Guide is recommending actually 7 to 8 servings per day. So we need to help educating those clients with prediabetes that 5 is not enough, and we're thinking maybe some previous messaging saying 5 to 10 a day recommended, people kind of stuck with the 5 is good enough maybe, and then we need to help people overall increasing their intake of those colorful vegetables and fruits. And as I was mentioning, the orange colored vegetables in particular seem to be less frequently consumed. What we also saw is top facilitators to healthy eating included knowledge on the benefits of consuming the vegetable and fruit, as well as advice from health professionals. This is also what was reported by studies of YEH and collaborators. Leading us to this third project that we're about to start in May, that we call Prepare. It's a community-based, healthy lifestyle, patient-centered education for middle and older adults to help to strengthen delivery of health services to assist individuals at high risk for diabetes, basically giving more access to education for individuals with prediabetes. And we have all of our partners supporting us to strengthen that education program. And the clients keep on telling us they want more education, so we're pleased to offer a program over 6 months this time. And the Lawson Foundation is providing us with great support and funding. The overall aim of the project is to create, deliver, and evaluate a 6-month community-based interdisciplinary education and lifestyle improvement intervention that we call Prepare, and which stands for Prediabetes Research and Education Promoting Activity and Responsible Eating. Through this new program, we will be emphasizing goal setting and self-management. We will be informing, but also engaging and monitoring and supporting those middle and older adults who have prediabetes in making positive lifestyle changes. We will encourage participants to reflect on their current lifestyle, barriers, facilitators, and the resources they have access to. We want to help increasing not only their knowledge, but their skills, motivation, self-efficacy, and awareness of more community resources in order to help them to make those positive lifestyle changes known to help reduce the risk of type 2 diabetes and hopefully to sustain those changes. We have 4 specific objectives. First, to assess and compare some of the characteristics of these individuals, middle and older adults diagnosed with prediabetes in our community. We want to, secondly, implement and evaluate the overall effectiveness of this new Prepare program. And we'll do that by helping to raise participants' awareness, knowledge, and self-efficacy about making positive lifestyle changes. And we will be hopefully helping to lower some key biochemical and anthropometric markers known to increase the risk of developing type 2 diabetes. We will be thirdly performing a process evaluation of the practicality, feasibility, and acceptability of the Prepare. And we will compare to see if the program is best serving middle and older adult participants. So do middle and older adults have different needs? I think they do. And 4, we will be assessing food and nutrition and interdisciplinary student experiential learning, including their attitudes and beliefs about the benefits of being involved in the program. Coming back to the new program, the Prepare program, the eligibility criteria that we have for now to assess the effectiveness of the program will be on a sample size, and then we're hoping that if the program is effective, that we will be able to open up to most individuals with prediabetes. For now, we will be welcoming middle and older adults who have prediabetes, and do not have some other characteristics that would increase their need for specific support that we might not be able to offer currently as we're developing the new program. For example, we know that in pregnancy, women have some specific needs, and there are other programs who are supporting those women, so that our new program might not be the best program for those women. Again, the participants would have to be able to come to the education session to eat a balanced diet, so they couldn't be on fiber restriction, and they would have to be able to walk and do low-impact physical activity and to understand English well enough to be able to benefit from education in English, as well as being able to provide feedback through questionnaires in English. This slide is a little bit heavy, but I'm going to run through, and don't hesitate to ask me questions afterwards. So basically, as is currently done, when the physicians are diagnosing the clients with prediabetes, they're referred to the Diabetes Education Center to be scheduled for education if they wish. And then once they are scheduled, they're provided with information about the different options they have. And when they come for their baseline visit, then they will be asked to self-select the option they prefer between 3 options. In summary, clients could decide that they would like to be part of the research project and have access to the new 6-month education program with follow-up right after the intervention and 6 months later. Or they could decide that they are only available and wanting to have one standard group education session that is the standard of care that we've been offering up to now. That would also apply if they're not eligible for the research project. And so the option 2 or 3 is basically them coming for the one education session and deciding if they wish to provide information and serve as a control group for us, or if they do not wish to take part in research, which would be option 3. Again, we will not force anyone. If they are willing to share some information and feedback with us, we will recontact them if they would like to provide information right after at month 8 and at month 14. This will allow us to see if the longer program with more education was more effective in helping the individuals. Some of the biochemical and anthropometric markers we will be looking at baseline and right after the education program of 6 months, and then after another 6 months of washout. So we will be looking at the A1C, plasma glucose, lipid profile. Of course, we'll measure the height at baseline, and then the weight, waist circumference, and blood pressure. Some of the questionnaires that we will ask individuals to use to provide us some feedback are listed here. At the same time, we hope that some of the questionnaires will be helpful for individuals to self-reflect on their current health and lifestyle, and will be able to help them to set some of the healthy lifestyle change goals for themselves, as well as keeping track of how they're doing with their self-management. And we, of course, really want the feedback to see if the program is helpful for them. So after each education session, we will ask them their feedback, and afterwards we will ask them if they want to take part in a focus group to really have a little bit more detail if they wish to let us know what worked for them and how we can better the program. Some of the highlights of the new 6-month Prepare program include that, well, they will have access to 6 months of free nutrition and physical activity education with interactive, hands-on activities and ongoing monitoring and communication with health professionals, and possibility to take a look at their health and self-monitor how they're doing. We will be supporting them, assisting them to make some realistic lifestyle change goals, to empower them to self-manage and do something, understand that they can do something about their lifestyle and health. We will have some drop-in periods with the dietitian, so it's group education, but they'll have the possibility to talk to a dietitian individually to ask some questions or ask for feedback, and they will continue to be able to bring somebody to support them, and we will have some incentives to help them to stay engaged and keep up with their goals, their personal goals. We will offer them a free pedometers. We are developing some cooking classes. We'll have a walking club. We'll have a healthy eating calendar, exercise passes, including to the Canadian Centre for Activity and Aging at Western. And if they continue with us, which we wish, we will give them a 1-year free membership to the Canadian Diabetes Association. And so we are trying to select incentives which will be helpful for them in improving and sustaining healthy lifestyle changes. So again, the nutrition and physical activity education will happen every month at Brescia University College. They'll be able to select if they want to come on a Friday afternoon or on Thursday evening every month to learn about healthy eating and exercising. We're actually doing some of the exercises with some specialists from the Canadian Centre for Activity and Aging, and we will have 2 demonstrations and hands-on activities. Optional, we will have some cooking workshops, and this is just to show you some of the things that we've been working at. Our student team has helped with our dietitians to develop some healthy recipes with a variety of vegetable and colorful fruit, and we are excited about sharing those with the clients, sharing those recipes, showing them how to cook them, and when they come for the monthly presentations, to try them as 3 demonstrations. So again, this will not be mandatory, but if they wish to have access, as well as a weekly walking program, again optional, but if they would like, and the walking will be at the speed they want, so we will have some groups doing some of the walking or jogging as they wish. Again, helping to keep up with some of their monthly goals. So we believe overall that the Prediabetes Initiative and Partnership Program can help individuals to delay or prevent diabetes because it demonstrates innovation, is community-centered, it promotes effective partnerships, helping to synergize our resources. It is evidence-based and based on Canadian Diabetes Association guidelines, but you can see that we are using some of our results that we're obtaining through research, our research and research of others, to help improving education and better meet the needs of the client. And we constantly include evaluation plans. We like to hear from our clients and share the knowledge with them. We have some web pages that I will show you the website at the end. We're presenting to conferences, to community groups. Last Saturday I was presenting at the London Library to try to share back with the clients what we're gaining from their feedback. And we believe that the program is sustainable and it provides tangible benefits for the London community, for the individual clients, but also through research, and that can help to benefit some other centers. And in fact, I'm starting to have some of our graduates reaching me and saying, now that I'm aware of what the needs of individuals with prediabetes are, how can you help us, or how can we develop our prediabetes education program? And, going to meetings and conferences, other healthcare professionals and groups in the community, in various communities are trying to develop their program, and we're quite happy to share some of what we've been doing. And we believe that the program is worthwhile also for those who may end up developing type 2 diabetes in the end, because it will help to raise their awareness of self-management, that they're at the center of their own care, and including the role of the individual themselves, their family, care providers, their community resources, and the importance of taking their medication. So diabetes prevention, please follow the signs to Brescia University College for a new Prepare program for a healthy lifestyle, which will be starting soon. So overall, I hope that this presentation has helped to inform you about the Prediabetes Initiative and Partnership in London, Ontario, and that you know a little bit more about the programs and the research that we're doing. This is our new logo. Again, as I was saying, we're planning to start in May, and you can see our web address here if you want to follow up with us or if you wish to reach me. So thank you, everyone, for joining us. And again, I thank the Canadian Centre for Activity and Aging for welcoming me and for partnering with us. I'll be happy to take any of your questions.
So we'll open it up now for questions.